Sawubona, siyakwamukela ohlelweni le-Mindset Health Channel esigawini esikhuluma ngocansi, izidakamizwa nesandulela ngculaza. Lesi sigawu sikhuluma kabanzi ngezinye zezinto esizenzayo ezenza sibe senqupheni yokuchaphazelwa isandulela ngculaza. With me in the studio, I have Dr. Roger Meyer, a medical director in Kenilworth Clinic Addiction Treatment Program.
That's right.
Welcome, doctor.
Thank you.
On my left, I have Blake Tilly, who's a recovering injecting drug user. Hi, Blake.
Hi.
And we also have Dr. Eric Uja, who's a medical demographer in HSRC, right?
Right.
Okay, welcome, gentlemen. Njengamanje uma siqhathaniswa namanye amazwe omhlaba, izinga lokuthola isandulela ngculaza ngezidakamizwa ezijovwayo liphansi kakhulu eNingizimu Afrika. Kepha sidinga ukuthola izindlela zokuvimba ukwanda kwezidakamizwa ezijovwayo. Isandulela ngculaza singadluliseka ngokusebenziselana izinaliti lapho abantu bezijova nganoma yisiphi isidakamizwa njenge-heroin, i-cocaine, i-tick, i-crystal meth noma i-speed emithanjeni yabo. Igazi eliphuma kumuntu onesandulela ngculaza lingadluliseka kalula komunye umuntu ngokusebenziselana izinaliti. Kwamanye amazwe njenge-Russia, eMpumalanga Europe, imbangela enkulu yokuthelelana ngesandulela ngculaza ngokusebenziselana izinaliti lapho abasebenzisa izidakamizwa bezijova. Yize lokhu kungakabi inkinga enkulu eNingizimu Afrika, kumele sithathe izinyathelo kusemanje ukuze kungabi inkinga kusasa. Sihlangene noMendi ngekusilo igama lakhe langempela, oneminyaka engu-22, osalulama ekungenweni umkhuba we-heroin eGoli.
I started experimenting with dacha and ecstasy and then a bit of speed and coke when I was in my teens. And I used to sort of go to clubs and raves and take ecstasy every weekend and then every day. And sort of before I knew it, I couldn't perform socially without some sort of chemical. I also used to use diet pills every day and then tranquilizers to get to sleep. So I think I was an addict before I started using heroin. From the first time I took it, I absolutely loved it. I smoked it for 4 months every day from that first day. I felt like I'd come home. It was the most fantastic drug ever.
Heroin is a so-called opiate, which is derived from the Asian poppy plant. It basically acts as a painkiller or sedative, and it usually has the appearance of a whitish or brownish powder.
My lifestyle was absolutely pathetic. I was at university and I tried my very best to carry on with my studies, but I couldn't function without drugs. I couldn't perform the simplest of daily tasks without a hit. I mean, I needed a hit before I got in the shower, or before I answered the phone or went to the shops. I was living with my drug dealer boyfriend, who was very manipulative and also a heroin and crack addict, very abusive, and had all sorts of weird sexual fetishes, which I gave into because I needed my drugs and I didn't have a job and I had a very expensive habit. I was prostituting myself for drugs.
Heroin is a particular problem in that it is physically addictive, unlike some other drugs like tick or crack or cocaine. And because of the physical addiction, obviously your user can become a more desperate person in terms of doing certain things to get hold of the drug. They are also usually more difficult to get off the drug. They need inpatient rehabilitation, whereas other drug users can often be treated or counseled on a so-called outpatient basis.
Physically, I was falling apart. I was very, very thin, couldn't keep food down. I was always sick. I had sores all over my face from scratching. I had infections all the time. I was constantly had flu. Yeah, it was sordid and miserable, and I just sort of floated around in this unhappy little bubble, and the only thing that mattered was the next hit and getting and using, and yeah.
Most people would eventually move to injecting in order to use less of the drug and to have a more efficient route of administering the drug. So most users would eventually progress to injecting, yeah.
And I think I'd always had a fascination with needles. When I was at school, I used to cut myself. And the sight of my own blood has always quite excited me. And needles were sort of glamorous and sort of heroin chic, and I was quite self-destructive, and I lived up to that whole, that lifestyle. I shared with my boyfriend right from the start, and he shared with lots of other people. And if there wasn't a clean needle around, I would. I generally rinse them out with alcohol or tap water, but I mean...
Perhaps the number one concern of sharing needles would obviously be the transmission of HIV. But then what's also very common is hepatitis C in particular, and other hepatitis variations like hepatitis B. And also through the use of dirty needles or unclean needles, you could develop skin abscesses, even tetanus, and those kind of skin problems, collapsed veins, things like that from injecting in the same place too many times. Needle sharing is, for example, a much more efficient way of transmitting HIV than heterosexual activity.
The fear of HIV does not come into your head when the next hit is right around the corner. If there's a clean needle there, I would have used it, but if there wasn't, and too bad. While I was using, I was pretty sure I was HIV positive, sort of in the back of my head. I didn't think it was possible that I wasn't, but I didn't really want to think about it. When I cleaned up, I went for a whole range of blood tests, and miraculously I was clean on all counts. I don't know how, but I was just very, very lucky, I guess.
Sizobuya emva kwalokhu unganyakazi. Imiphumela yocwaningo lethu iveza ukuthi eningizimu Afrika ukuzijova kwezidakamizwa kuyakhuphuka, nokuthi kuholela ekuziphatheni okuyingozi enkulu njengokusebenziselana izinaliti. If I may start with you, Dr. Ujo, as we've seen from the inset, the lady was using heroin, injecting heroin. There was a point where she was scared that she might be HIV positive because of sharing the needles. So now we can see that there's different ways of actually spreading the HIV. Do you want to talk more about that?
Yeah, there are different ways HIV can be passed from somebody who is infected to somebody who was previously uninfected. And in order of importance, these are unsafe sex, transmission from mother to child at birth, and intravenous drug user, that is what we were talking about in the inset.
Intravenous?
That is injecting heroin or some other substance into one's body. And lastly, the use of contaminated blood or blood products.
Why is injecting drugs so dangerous?
Injecting drug is a very efficient way of transmitting HIV because the concentration of the HIV is very high in blood and in blood products.
When you use a needle, you leave some of your blood in that needle, okay? And then if you give that needle to someone else and they use the needle, they're going to inject some of your blood into them, okay? So as a result, if you've got HIV, if I've got HIV and I shared a needle with you, and you use the needle right after me, you would be injecting my blood straight into your bloodstream, and as a result, the risk of you contracting or catching HIV from that is extremely high.
How common is sharing needles?
When you're using, you don't care about things like HIV infection. I think that was mentioned in the insert. You will make a plan to scrape together 200 Rand to buy yourself a gram of heroin. But there's no ways in the world you are going to have 2 Rand to buy yourself a needle from a chemist or something like that. And that not only leads to sharing needles, it also leads to using the same needle over and over and over and over again.
It's absolutely true. Within the South African context, because the incidence of HIV within the pool of injecting drug users is still very small, there isn't a consciousness about HIV as a risk with intravenous drug use. It's more about sexual contacts. The vast majority of South African heroin addicts quite readily and without any hesitation will share needles.
And I think with me as well, I resigned myself to the fact that I was never going to be able to stop using. So if I contracted HIV as a result of that, who cared? You know, I certainly didn't, because I knew, deep down in my heart, I knew that I was going to die
Anyway.
a heroin addict. And within a couple of years or whatever, I knew that, because I tried to give up so often by myself and I just could not do it. So, you know, the fear of contracting HIV never really existed in my mind, because I just didn't care.
And what other infections can you get from sharing?
Well, the other viral infection that we're very concerned about, and there's an increasing incidence that has been documented in South Africa, is a virus called HCV. It's hepatitis C virus. That's a virus that's transmitted specifically through intravenous drug use. And then in addition, there's a very high risk of just injecting your average bugs, bacteria that cause pneumonia, that cause septicemia, that cause abscesses, that cause kidney infections. So the health status of most heroin users is pretty poor as a result of using non-sterile equipment. And I say this is irrespective of the HIV or HCV risk.
Now, Blake, you're a recovering user. Do you want to tell us how you started?
Yeah, I basically just started experimenting much as the girl in the insert did. And I think when I was about 20, I tried heroin for the first time. And that to me was just the most truly wonderful experience. I was extremely sick and nauseous and vomiting and that, but what it did for my mind, it just shut out all the noise and all the emotion. I didn't feel anything. I didn't have to worry about anything. I didn't care about anything.
There is a honeymoon phase where people who start using the drug can't believe that a substance can provide them with such a sense of well-being. But as Blake will no doubt point out, that honeymoon rapidly becomes a nightmare.
And when did you actually realize you had a problem? What?
I think it was fairly soon. A lot of my friends, you know, and it became very clear to me that I had to use every day, otherwise I was sick. But I kind of sort of resigned myself to the fact that this was a rock and roll type lifestyle that I almost aspired to. I wasn't very happy with my profession, what I was doing in that, and for me it was a way to rebel against that.
Might I ask what you were doing?
I was doing my articles.
As a chartered accountant?
As a chartered accountant, yeah. So, yeah, it sounds a bit strange in that the two certainly don't mix, but that's I think, it doesn't matter what you do, it doesn't matter who you are, it doesn't matter whether you're black, white, Asian, female, male, or whatever, it affects everyone equally.
Can I ask you a question?
Sure, Roger.
The interview with Andreas from the MRC, he said, and I'm interested in your opinion, but I don't agree with him, that most heroin users will inevitably go on to injecting the drug, and the statistics suggest that that's not true. I'm curious, in your case, what made you move from chasing the drug, in other words, smoking it, to injecting it?
For myself, it was about money. I didn't have enough money to buy the heroin that are needed to sustain not going into withdrawals. And when you inject, initially you use less, okay, because it goes straight into your system, and you need to use less to get that high. And obviously less becomes more, and then chances are you're using exactly the same amount that you were when you were just chasing. But that's initially how I got into it, was an economic decision on my part.
You did a cost-benefit analysis.
Absolutely. Being an accountant.
You worked it out.
Better return.
Thank you very much, Dr. Uchu, for joining us. Siyaphinda sibuye emuva kwekhefu. Sikhuluma ngezingozi zokuzijova ngezidakamizwa nokuthelelana ngesandulela ngculazi. Enye yezindlela zokunciphisa ukusebenziselana izinaliti uhlelo lokutshintshwa kwezinaliti. Kulolu hlelo abasebenzisa izinaliti bangaletha izinaliti zabo esezisebenzile bazitshintshelwe ngezintsha nezihlanzekile. Lezi zinhlelo zisekhona kwamanye amazwe ase-Europe kodwa azikho lapha eNingizimu Afrika. Sibonane noRicky onesandulela ngculaza oselulama ekusebenziseni iheroin. Ukholelwa ekutheni wathola isandulela ngculaza ngokusebenziselana izinaliti.
There's 8 months I'm in South Africa, and I came here because I'm a drug addict and I wanted to stop with drugs. And I got to a point in my life that I really felt I had to move from my family, my friends, my country. I just wanted to start it all over again. First time I tried drugs, I was 14 years old. I smoked some dope, hash. Europe is more hash. And after 16, I started injecting heroin and cocaine.
While we're perhaps not at the levels of other countries such as the European countries and Australia, some of the Asian countries, we have seen a fairly steady increase in the use of heroin in South Africa, particularly in the large urban centres like Cape Town, for example, Johannesburg, Pretoria.
I always used to have my own syringes, but it was one night that I was in a bad state. I was using a lot of drugs. My parents had taken my car away from me, and this was in the middle of the night. And there's a place where I went to buy, to score, and after I was going to spike there in that place, and I had already the drugs ready to spike. When I was pulling it with my syringe, my needle broke. So it was like I didn't have much money at all. So it was like I just wanted what I was there. That moment I didn't give a damn about if I was gonna get it or not. So I ended up by borrowing the syringe from someone that was there that I didn't even know. I just wanted it. My priority was to spike that.
We found in our research that actually a lot of heroin users are fairly aware of the danger of sharing needles and are aware of how HIV is transmitted. But often when someone is so addicted to the drug that they are basically desperate to get the next fix or the next high, they will disregard or forget what they know and share needles anyway.
I went to a treatment center, and a couple of 3 or 4 weeks later I got fever, very high fever, no more symptoms. And they drove me to hospital, to casualties. They made blood tests to me. They told me on the phone, and I was just crying. I was clean. And I couldn't stop to cry. And my first reaction was I didn't want my family to know, because I know they were gonna feel very hurt, also because it was 11 years ago, so it was like, there wasn't much hope for HIV and AIDS 11 years ago, and I just thought I'm gonna die soon. I really believed that I was gonna die.
Hi, can I help you? Is this the needle exchange place? Yes, it is. My name is Melissa. Just before I can give
In countries which have these so-called needle exchange programs, it's usually set up either by local NGOs or sometimes even by local government. where you would have a place where injecting drug users can go, often obviously in an area where there's a lot of drug use, and they can bring their dirty needles and they'll get clean needles in return.
I think the needle exchange program is very important, because really you get, when I was using, when I was injecting, and I see also people that I know that were doing the same, you get so busy using and buying and getting money that sometimes you don't have much time to go to the pharmacy, or it's lunchtime and pharmacies are not open, or it's at night, and you need a lot of syringes. You do need a lot, So there's, in Portugal, the way it works is that they stop these cars or vans, with syringes. You've got to keep your old syringe and you have to give it back to them. And they give you new ones all the time. They give you like a kit with cotton, water, because that's very important also, and syringes and condoms.
Here's some founders for you. I'm also going to give you a pamphlet about how to reduce the risk of HIV and hepatitis. How are you feeling today?
Good. Feel good.
If you're ever not feeling well, just come back to me and I can refer you to an off-site clinic for treatment. Also, here we have a HIV counseling and testing center. So if you ever need an HIV test, just come in and speak to me.
Drug addicts, you can put a drug addict here, or in Australia, or in the States, or in Portugal. We are all the same. The symptoms are the same. So this is not South Africa is not gonna be different from Europe or other states. And people are, I think, should learn from the experience of the other countries that now this is new in South Africa, drug injection. Maybe you still can do something about it.
In this segment of the show, we are joined by Dr. Greg McCarthy, who's a psychiatrist and addiction specialist. Welcome, doctor.
Thank you.
I guess the question I would like to ask is, should South Africa be looking at putting needle exchange programs in place? Gentlemen?
Well, in my opinion, having seen that insert, I've got absolutely no doubt that the sooner we introduce needle exchanges, the better. Obviously, the readily available of clean and sterile injecting equipment reduces the risk of HIV transmission. So it certainly is a harm reduction mechanism that attempts to solve that problem. But in addition, in making needle exchanges available, the addicts are now having contact with mainstream structures, like in that case a pharmacy, and so it serves to bring the whole problem of addiction out of the streets and out of the closet, and it in the process it destigmatizes, it helps destigmatize the condition.
Just to pick up on one thing that was said in the insert, where she was saying, this is somebody who's not a South African saying, she doesn't see why South Africa should be different to any other countries. The fact is South Africa is already very different in the sense that the whole of sub-Saharan Africa, transmission of AIDS is a sexually transmitted disease with very little contribution, in fact, made by intravenous drug use. We have to look at what promotes unsafe sex, and which drug promotes unsafe sex more than any other is alcohol, by far. And what concerns me is not that we shouldn't be doing these things. We should. It makes sense. I agree with Roger. It's harm reduction. But we live in a country where there's grossly irresponsible promotion of alcohol use. And so my one concern about making needle exchange programs available is that it looks like we are doing something when in fact we are addressing a tiny, tiny area and neglecting a bigger area. And that's of concern to me.
So you're not necessarily opposed to it, but you just think that we should look at the bigger picture.
Absolutely not opposed to it. The bigger picture is huge, is what I'm saying.
Needle exchanges introduce a very important proactive element to the whole approach. It's saying we care, we're prepared to provide this sort of structure, this sort of service, but it needs to be not done in isolation, in my opinion.
In a sense, what you're saying is we accept that these people are not going to stop using drugs, and so there's a certain amount of, well, we throw our hands up, we say, okay, they are so uncomfortable when they're in withdrawal. Let's rather leave them using their drugs. But in some ways, you are in fact giving up
just from my side, I know that if I had contracted HIV, I wouldn't have cared about a thing and I just would have carried on using. So if we can prevent incidents like that happening, then certainly a needle exchange program would make sense.
Namuhla sifunde ukuthi isandulela ngculaza singedluleka kalula kakhulu ngokusebenziselana izinaliti lapho abantu bezijova ngezidakamizwa emithanjeni yabo. Uma uke waqala ukusebenzisa izidakamizwa kunzima kakhulu ukuyeka. Awugcini nje kuphela ngokungenwa izidakamizwa kodwa uzithola sewenza noma yini nje ukuze uthole isidakamizwa esilandelayo ukuzisiza uma useqalekile. Ezinye izidakamizwa njenge-heroin singena kalula kakhulu kumuntu kube nzima kakhulu ukuzelapha. Indlela esebenza kakhulu yokuzivikela ukuthi ungaqali nokuqala nje ukuthatha izinto ezidakamizwa. Nokho ke uma ngabe ungumuntu ozijova nganoma yisiphi isidakamizwa qiniseka ukuthi awusebenziselani izinaliti zakho nabanye abantu futhi usebenzise inaliti entsha njalo uma ujova. Uma unenkinga yanoma isiphi isidakamizwa siza ushayele noma iyiphi kulezi zinombolo sosizo.